Welcome to the Pneumonia Masterclass. This video will focus on clinical excellence in nursing management, ensuring you are exam ready. Let's start with our first question. Which microorganism is the most frequent cause of community-acquired pneumonia, or CAP? The correct answer is B, Streptococcus pneumoniae. It is the most common bacterial pathogen responsible for community-acquired pneumonia worldwide. Pneumonia involves inflammation of lung parenchyma. What is the classic finding on auscultation in a consolidated area? The answer is B, bronchial breath sounds. Consolidation, meaning fluid-filled alveoli, transmits bronchial breath sounds to the lung periphery. Next question. Which of the following is an early physical sign of pneumonia during palpation? The correct answer is B, increased tactile fremitus. This occurs because consolidated tissue transmits sound vibrations better than healthy, air-filled lung tissue. A priority nursing diagnosis for a patient with pneumonia is ineffective airway clearance. What is the best intervention? The answer is C, encourage deep breathing and coughing. This helps mobilize secretions for expectoration, effectively clearing the airway. Why should nurses avoid administering cough suppressants to pneumonia patients unless absolutely necessary? The correct option is B. They prevent removal of accumulated secretions. Suppressing the cough reflex inhibits the clearance of purulent exudate, potentially worsening the infection. An older adult is diagnosed with pneumonia. What is a common atypical presentation in this age group? The answer is B, confusion or altered mental status. Elderly patients often present with nonspecific symptoms like confusion or lethargy, rather than a high fever and productive cough. Which of these is a preventative bundle component for ventilator-associated pneumonia, VAP? The correct answer is B, keeping the head of the bed, HOB, at 30 to 45 degrees. Elevating the HAP reduces the risk of aspiration of gastric contents, which is a key cause of VAP. What is the most effective way to confirm the diagnosis of pneumonia? The correct answer is B, chest X-ray. It is required to confirm the presence of lung consolidation or infiltrates consistent with pneumonia. Mycoplasma pneumoniae is often called. The answer is A, walking pneumonia. Mycoplasma causes a milder, atypical pneumonia, allowing patients to continue normal activities. Which of the following is an aspiration pneumonia risk factor? The correct answer is B, impaired swallowing reflex or dysphagia. This increases the risk of aspirating food or secretions into the lungs, leading to pneumonia. What is the CURB 65 criteria used for? The correct answer is C, assessing the severity of pneumonia. The CURB 65 score helps determine the need for hospitalization and guides treatment decisions. Why is adequate fluid intake, approximately 2 to 3 liters per day, crucial for pneumonia patients? The answer is A, to thin secretions for easier expectoration. Hydration makes secretions less viscous and easier to cough up, improving airway clearance. Which diagnostic result indicates an acute infection in pneumonia? The correct option is B, elevated white blood cell count or leukocytosis. This is a common sign of a bacterial infection, like pneumonia. What is a key risk factor for pneumonia in postoperative patients? The answer is D, shallow breathing due to pain. Reduced respiratory effort from postoperative pain leads to atelectasis and the accumulation of secretions, increasing pneumonia risk. Which nursing intervention helps prevent postoperative pneumonia? The correct answer is B, use of incentive spirometry every hour. This promotes deep inspiration, prevents alveolar collapse, and clears secretions, thus reducing pneumonia risk. Let's consider this question about monitoring gas exchange in pneumonia. What is the most effective nursing action to monitor gas exchange? The correct answer is C, monitoring O2 saturation with a pulse oximeter. This provides a continuous, non-invasive measurement of oxygen saturation, a direct indicator of gas exchange adequacy. Next, we have a question about a specific type of pneumonia. Pneumocystis jirovecii pneumonia is primarily seen in which patient group? The answer is A, immunocompromised patients, especially those with HIV/AIDS. This is an opportunistic fungal infection that preys on weakened immune systems. Moving on to complications. What is the complication called when pus accumulates in the pleural space? The correct option is D, empyema. This is a severe complication of pneumonia requiring drainage, often via a chest tube. When starting antibiotics for pneumonia, what must a nurse do first? The answer is D, collect a sputum culture. Obtaining a culture before starting antibiotics is vital to identify the causative organism and determine appropriate treatment. What describes hospital-acquired pneumonia, HAP? The correct option is B, pneumonia developing 48 hours or more after hospital admission. This definition distinguishes HAP from community-acquired pneumonia. Which of these is a preventative measure for pneumonia in infants? The answer is A. Breastfeeding. Breast milk provides antibodies and immune factors that protect infants from respiratory infections, including pneumonia. Finally, what causes pleural friction rub in pneumonia? The correct answer is B. Inflammation of the pleural linings. When the normally smooth pleural surfaces become inflamed, they rub against each other during respiration, producing the sound.